Well, meantime, Malaysia says that it's agreed with Singapore to establish a joint committee to handle the coronavirus outbreak. Senior health officials from both sides are aiming to strengthen cross-border efforts to contain this virus. Melissa Goh joins us now with the details. Mel, what's come out of today's talks?
Well, basically, the health ministry officials from both countries, led by the health ministers, Dr. Zulkifli of Malaysia and Mr. Gan Kim Yong of Singapore, they held an hour-long video conference to discuss ways to strengthen existing cooperation to better contain the spread of this virus. Now, both countries agreed, first of all, to set up a joint working committee and identify the terms of reference. Now, the focus is to coordinate implementation of thermal scanners for the exit screening, so there's no duplication. Details are still being worked out. There are easily more than 200,000, 300,000, in fact, commuting each day to work in Singapore. This is of great urgency. Also, both health ministers, they also talk about sharing of information in the areas of public health, clinical management and treatment, as well as in the area of research, standardising the protocol of treatment so that both countries can pool their data and share their experience and outcomes to better fight the virus. Now, at the news conference just a while ago, Malaysia Health Minister also spoke about the close link between the two countries and why the need to come together to set up this joint committee. Let's listen in.
We are so close to one another. We have got, historical relationship. We have got good bilateral relationship. All the more we share the same causeway. There are 100 over traveling across each day for reason of family, business and leisure. So all the more why we should strengthen and enhance our cooperation managing this coronavirus outbreak.
Now, Dr. Zulkifli also stressed that there is no travel advisory against visiting Singapore. Now, the Director General, Dr. Noor Hisham, I spoke with earlier, said that Singapore has reassured Malaysia that it's under control. The contact tracing is able to detect the origin. Malaysia's stance remains the same. There's no travel advisories, and that Malaysians must exercise good hygiene at all times. So if there's any non-essential travel, it's up to Malaysians to delay or postpone it. Certainly, there's currently no plans to issue any travel advisory.
Mel, what measures do both sides intend to carry out, though?
Well, they're currently still working out the terms of reference. Of course, the immediate concern is at the border, at the checkpoints. When they do, make sure there's no duplication. When they do the thermal scanning, make sure whether it's at the exit or at the departure side, it still remains to be worked out. It's still a work in progress, but given the urgency, both sides are coming together. They are sharing notes while they are treating. They are also researching. It's a sharing of data that they need, and also the use of antivirals, given that it's off-label usage, so they need to make sure and synchronize as well as coordinate efforts to make sure that if the virus were to go out of hand, at least they know what to do. There is a standard operating procedure, both at the causeway, both sides know what they're doing. As I mentioned, there are 300,000 that are crossing the border each day. So it's of utmost importance that both countries work together to make sure this virus is contained.
Indeed. Thanks very much, Melissa Goh, speaking to us in Kuala Lumpur.